It's a complex interface, isn't it, between the richness of evidence and that having inherent value, and then the personal passion, but without getting into anecdote.
As a caveat to that, I would say, and one of my founding kind of beliefs of all of this is that we really need to share our stories with each other and share our failures and our successes, and hence why doing this is important to me. But I think it's doing it in the right context, and I think it is, and with the right audience. So for example, for the opening launch of Swim, I shared my professional story, which included telling 200 people about having a subarachnoid, having doubts about whether I could be a good mother and a good doctor. And that's probably one of the most terrifying things I've ever done. But I hope that by doing that, I want to inspire other people to be able to feel more comfortable with to share their stories, because everybody's got challenge in their lives.
Were there things that you saw there that you will bring back to the NHS?
I think because I've worked in Africa for quite a long time, I see a lot that inspires me from African settings to what I do here. And some of those are the basic issues around inequalities, social inequalities, health inequalities, how important they are. When you see them on a global scale, you realise how important that is.
I'm curious to know, who were your role models and who inspired you along your journey?
I've been lucky enough to work with some amazing doctors and some amazing nurses and therapists as well. I was lucky enough to work with Professor Mully before he retired. He's a very inspirational person to work with, in the sense that he embodies what it is to be a geriatrician and what it is to stand up for the rights of older people and get them a better deal. And every patient that he saw got his full attention, and such a detailed analysis of what was going on with that patient and how we could help. And that was very inspiring to work with. I was lucky enough to work with Pete Belfield before he retired as well, and he was, although a very good doctor, and I respected him for his clinical skills, but he really looked after me as a person and how I developed, and was always there for each stage of my career, helping me with interview practice, helping me with application forms, and sort of champion me in the sense that, yes, Kate, you can do this, you've got all the skills, and really sort of building me up and coaching me almost, I suppose, to get through the different barriers in my career. He was very inspiring to work with. And then a doctor I work with now, Frank Phelan, he's the head of clinical service at Pinderfields, and essentially my boss and my mentor, and I always respected his clinical skills and his ambition to do better for patients and drive change in the department and improve services. Even when he wasn't head of clinical service, he always wanted the service that he provided to be the best that it could be. And he was a really, well, is a really inspiring mentor. He encouraged me to write in the first place, and really pushed me forward with the other things that I do, and support me in that.